Hey everyone, welcome to Holistic Lifestyle Tips, Getting Real About the Woo Woo. I am Becky Russell, owner of wellness company Hope Essential, and I'm a holistic lifestyle educator. And that means I believe in treating the entire body, the mind, body, and soul from the inside out, and not just treating symptoms, but getting to the root of your health concern. And I also believe that we need to limit the amount of chemicals that we put on and in our body, that's one of the things that is making us sick. And I want us to, myself and you, to have a quality of life as we age. And I think that limiting those chemicals is one way to do that. And so when I found doTERRA essential oils several years ago, they were the perfect fit for my holistic lifestyle because they are wonderful tools to eliminate the chemicals. And also there's the therapeutic benefit of the oils. So it's just a perfect fit. And I love to educate people about them, how easy it is, because if it's not easy, I don't do it. So anyway, holistic living, I've been doing that for over 25 years. And since I am not genetically blessed in many ways, I believe that is what has kept me medication free so far. Most of my family has not been that lucky that was older than me. And so I really believe in what I'm doing. So I want to share what has helped me stay healthy. I'm not perfect. I have my issues like everybody else, but I am constantly working on it and just want to share that journey with you and open your mind up maybe to these other choices, these holistic choices that maybe you don't know about. So I try to alternate between emotional wellness, physical wellness, and spiritual wellness. And tonight we're going to talk about physical wellness. It is week 21. And we're going to talk about something that might be a little controversial, but I think it's very important. And that is regenerative medicine. In particular, stem cell therapy. So if you have chronic pain, let's just talk about knees for tonight because it's simpler and that's the most common thing I run into with people I meet. Chronic knee pain. So if you have good insurance, you've probably done all the things you do first. You've gone to physical therapy. You've probably done some type of steroid injection, which honestly, the studies have shown that that creates more problems down the road. But do your research. There's just even taking over-the-counter Aleve or something every day that's hurting your gut health and stomach lining. And so, of course, pain meds are not a good long-term solution at either. So chronic knee pain is debilitating. So you have to do something. You've tried acupuncture, chiropractor, hopefully you've tried all those things, and it's bone on bone, and you've got to do something. So my theory is surgery is the last option. I'm not saying never have it, of course. Life-saving surgeries are necessary, and sometimes you have no choice. I had back and neck surgery. I did not particularly want them, but they did improve my quality of life. So had I known about regenerative medicine, I'm not, maybe that would have been an option, but I had to go with what I knew at the time and what was available at the time. So surgery, absolutely, but I did try everything else first, and that was the answer. So, and I have had quite a few people say that they had knee replacement surgery and everything went well, and they were sorry they waited so long to do it. So I'm happy for them, but what I know now, I would really investigate the stem cell therapy if I had chronic knee pain. So let's just talk about what is a stem cell, right? So They're the body's raw materials, cells from which all other cells with specialized functions are generated. Under the right conditions in the body, stem cells divide to form more cells called daughter cells. These daughter cells either become new stem cells or become specialized cells with a more specific function, such as blood cells, brain cells, heart muscle cells, or bone cells. No other cell in the body has the natural ability to generate new cell types. That's pretty cool. So, of course, there's a lot of science here. I don't have time to go into. You need to do your research. There's all different kinds of stem cells. And so you need to do your research on stem cells, on the facility, on the staff at the facility. So you need to do your homework and don't just rely on me, okay? So stem cell therapy, also known as regenerative medicine, promotes the repair response of diseased, dysfunctional, or injured tissue using stem cells. So it is something. It's the buzzword now. It's in the news. It's all over. A lot of people are doing it, but that doesn't mean everyone knows what they're doing or they're doing it in the best way possible. So again, do your research. You have to trust the person. Okay. So why am I so adamant about surgery being last? Okay, so of course there can be the risk of knee surgery, stiffness after the surgery, but of course that's probably a given. There can actually be noise related to the implant. So you could have some clicking or clunking after the surgery. The implants can wear out in time, and then you'd have to have the surgery done again. You could, with any surgery, blood clots is a risk. And then the other thing that probably scares me as much as anything is infection, because I run across a lot of people with what I do. And I hear so many stories about people going into the hospital with one problem and coming out with an infection that makes things 10 times worse. And that becomes their life, trying to get rid of this horrible, you know, MRSA or staph or, some real serious infection. And so I personally, if there's any way I can stay out of a hospital, and I'm not saying just in this area, it's all over. I will do pretty much everything I can to avoid a hospital. And so, these are some of the risk with surgery. And the thing with the knee pain, it's not going away. We're all aging. And it's saying that every year about 600,000 Americans get a knee replacement, a number that could rise to 3 million by 2030. And it says until recently, treatment options were either temporary, such as physical therapy, or steroid injection, something like that, or surgery. So the stem cell therapy is exciting that it could be an alternative. And I can't go in, I don't have time to go into how it all works, but you probably understand there's cartilage, and that's the protective film. And when that is gone, it's bone on bone, and it's pain. And so you have to do something to have a quality of life. So stem cell therapy for knees is minimally invasive. It's a procedure that can decrease inflammation, slow and repair all these forms of damage from arthritis, and delay or prevent knee replacement surgery. So that is an alternative to check into. The big stumbling block I hear about is the cost. And I would really encourage you to think big picture here, because the average cost is $3,000 to $5,000 per knee, and I know that's a lot of money, but knee surgery is going to be a lot more than that. So even if you have insurance, most of us have, if we even have good insurance, the deductible is pretty high, and it may be close to that $3,000 or $5,000. So you're going to be paying out of pocket anyway, more than likely. So you would just be paying for the procedure in an office versus paying for a procedure in a hospital, the down payment or the deductible, and then you have a longer recovery time, which means more time off work or just being, out of commission. And, that's not fun to think about. So, and there's a lot of other reasons why the stem cell is so much easier on you. It's just less trauma. And so I would encourage you not to get hung up on whether or not it's approved by, whether it's covered by insurance or not, because the risk of surgery to me outweighs the other. And if you are, say you're on Medicare or, have the VA covering everything, that still is, I understand it's an expense, but the risk of infection and these other things is so high to me that I would really seriously consider paying out of pocket. Most places will set up a payment plan for you, but just really do your research about the risk factors of everything. And the other thing is, different people, different staff, different facilities have different methods. So I know my advanced or advocate integrated medicine, that is where I go for my chiropractic needs. And they have a different procedure for the regenerative medicine. And so I know, like, and trust the staff there. I've done my research and I would feel comfortable with that. But if I did not know them beforehand, I would do a lot of research to find out exactly how are they different from someone else. So I know how diligent Dr. Dunn is on his research and how he demands the best of everything. I know he is going to talk before the injection about trying to decrease the inflammation in your body to give you the optimal results. It's up to you whether you do it or not. But if you want the optimal results, you will change your diet and so forth and before the injection to get the best results. And then after, he works with you on the rehab more than maybe other places. So I just want to encourage you to think outside the box, open your mind, do your research. Don't just take my word for anything, but do, think about these other choices. It does not, the standard way of doing things is what has gotten us in this mess that we're in now, taking medications to help with the side effects of other medications. So let's stop and think about what other choices we have. So I would love to hear in the comments below, did you learn anything new tonight? Is it something that you think would be a viable option? Do you know of anyone who is suffering from chronic knee pain or some other kind of pain that this might be something they can explore? And just what was your takeaway tonight? And also, if you want to know more about holistic living, be sure and visit my website, hopeessential.com. And there's blogs and all sorts of things on there. So till next time, choose you, choose natural, choose now.